Hi, my name is Jawad H and I'm a medical doctor from the Department of Cardiology, Copenhagen University Hospital in Denmark. Now, I'm going to tell you about one of the papers I've done, which has been published simultaneously in JACC. So this is about atrial fibrillation, the efficacy and safety of atrial fibrillation in patients with heart failure and mildly reduced and preserved ejection fraction. So it's a post-hoc analysis of the DELIVER trial. So very briefly, we know that atrial fibrillation is very common in heart failure, especially heart failure with preserved ejection fraction. The prevalence is approximately 65%. Now, we also know that atrial fibrillation worsens the prognosis in patients with heart failure, and again, especially in patients with heart failure and preserved ejection fraction as compared to those who have a reduced ejection fraction. Now, we do know from patients with HFpEF that the efficacy of certain treatments might be less in patients with atrial fibrillation. For example, that of beta blockers, cardiac resynchronization therapy as well. However, other therapies, for example, Dapagliflozin, has a similar efficacy in patients with HFpEF. Now, we wanted to examine this question, namely the effects of Dapagliflozin in patients with heart failure and preserved ejection fraction with and without atrial fibrillation. Now, DELIVER was a randomized clinical trial which enrolled patients with heart failure with mildly reduced and preserved ejection fraction. Patients were randomized to placebo or to Dapagliflozin 10 mg once daily. What we found was that approximately 54% of the study population had any atrial fibrillation, that is a medical history of atrial fibrillation or atrial fibrillation under randomization ECG. We found that the efficacy of atrial fibrillation Dapagliflozin was similar in patients with and without atrial fibrillation for the primary outcome, that is worsening heart failure or cardiovascular death, and we found a similar efficacy for all secondary endpoints as well. The paper can now be found online on JACC. Thank you.